Today I shall be talking to you guys about Residency Chronicles. So a lot of people out there doesn't really understand how physicians are being trained. And I'm going to give you some information that might be more helpful so that people can have a better understanding of how doctors go through residency training. So after 4 years of medical school, you're going to apply for the match. Now the match is basically you've picked a medical student has picked a specialty that they want to go into. For example, I wanted to go into emergency medicine when I was in my 4th year of medical school. So I did multiple rotations, and at the end of my 4th year, after taking my USMLE Step 2 and Complex Level 2 exam, I applied for the match after rotating at multiple institutions, and then they give you a letter of recommendation. You fill out an ERAS application online, which is the Electronic Residency Application Service, which all the applicant pool sends their application every year, both international medical students and U.S. grads. Now, what happens is students are selected by different programs, either based on their board scores, how their letters of recommendations are arranged, and eventually they get a phone call saying, "Hey, Joe, you've got an interview at this hospital." And students go for as many interviews as they are offered. And at the end of the interview process, both the residency program and the student gets a chance to rank the programs according to their preference. So if you have 10 programs, you rank them from number 1, which is probably where you want to go, to number 10, which is the least likely place you want to go, but still you put them on the list. Now, there's a computer algorithm that now tries to match what the programs where you interviewed at ranks all the applicants, from 1 to whatever, 100, depending on how many applicants they get. And the computer try to match your preference with your match number from the residency program that you did interview at. If you do successfully match, what happens, you get a slot and you automatically go to that program. In January, which is the spring of the year when you're graduating medical school, most osteopathic applicants get a notification in February that they're matched, and allopathic, which are MD students, wait till March, end of March, before they discover where they're going. Now the excitement begins. You've got a job. You're going to go into residency. For me, I match into emergency medicine. So exciting. Exactly. So what happens next? Well, you graduate medical school, you get a cap and gown, you celebrate with your friends and family, and then the reality begins. And then you start your first year of residency training, which is known as an intern year. Now, intern year can be different based on which program you're in, but the general premise is you get to rotate at different departments in the hospital. For example, if you did a regular intern year, you do cardiology, then pulmonary, and then you do infectious disease, and you actually go through different departments, and then you get maybe about 4 months of training in your own specialty. So that's how it's broken down. There are electives that are split up in between, and then you get vacation time. Now, when it comes to the hours of residency, they're very, very brutal. Okay, they're not easy. When you start your residency, now you've got more responsibility from being a student. Okay, now the life of patients is in your hands. Now you have to make clinical decisions, which is going to impact patient management. A lot of work, a lot of responsibility, but it's very exciting because now all the stuff you learned in medical school, right? All that pathology, physiology, all that biochemistry that you've learned, now it's going to come to play. Now you're going to be able to apply it at the bedside while you're signing your name behind the dotted lines. So, what's the average hours a resident usually does? Well, it varies based on which rotation. But on average, most residents work between 60 to about 80 hours a week. Now, that's minus education time. So that's just clinical work. And then there's educational blood out time, about 5 hours of education, maybe every Wednesday or Thursday, depending on which program you're in, where you just purely dedicated to academics. And then there could be a journal club where you sit down and read articles and journals, and those are other extra hours. So, by the time you look at it, within a week, you're looking about close to 85 to 90 hours of just your dedication. Now, residents often have to be on call. Now, depending on what institution you're training, you might be on call every third day. What does a call mean in residency? A call simply means you come to work at, let's say, about 5 p.m. or 4:30 p.m. in the afternoon, and you don't leave the hospital until maybe 11 or 12 p.m. the next day, roughly about 20 hours of being in the hospital. Well, that's one kind of call. Another kind of call is you can also be on call for about 24 hours. Is that even possible? Yes. So in residency, as a resident, you get to stay in the hospital from 6 a.m. in the morning, and you don't leave the hospital until 7 a.m. the next day. Well, as an intern, obviously there's been changes. An intern, which is a first-year resident, can only do 16 hours of work. Okay, after that, you're obligated to go home. But, as you start to go up in years, you still get to do a 24 to 30 hours of work in residency. So now imagine you've been up from 6 a.m. taking care of patients. Okay, you're up all night still taking care of patients. And the next day at 6 a.m. you're still up and you're still there till 12 p.m. Okay, that's about 30 hours of nonstop clinical work. Okay, that's the demand that is expected from residency training. Most residency training is between 3 years to 7 years. So let's say you do a pediatric, or you do emergency medicine, internal medicines, family medicine residency. Those are 3 years long program. Now, if you start to do general surgery, this is about 5 years program. If you do neurosurgery, that's about a 7-year program. If you do 5 years of general surgery and you want to do a specialty like a fellowship, that's extra 2 years. So that's about like another 7 years total in surgery. Now, if you decide to specialize in internal medicine and go into fellowships, that means after 3 years of residency training, now you go into fellowship, okay? Now when you get to fellowship, that's another 3 years of fellowship or 2 years of fellowship, depending on which fellowship you go into, like pulmonary, if you want to do cardiology, gastroenterology, infectious disease, endocrine. These are subspecialties in internal medicine. Now let's talk about how residents are being paid. Well, payment in residency is little. Okay, well, that had some more insult to the injury, correct? Well, it's true, because what happens is after 4 years of medical school and you're in debt, right? You already got about $200,000 to $250,000 that you've borrowed to go into medical school. You're not getting paid in medical school. Now, when you get into residency, an average resident salary is between $40,000 and $50,000 a year. What? Yeah, that's true. Why? Because that's the sacrifice you have to make. So think about it. You've completed a 4-year bachelor's degree. Okay, some people have a master's degree, then go into medical school 4 years, and then you go into residency training, and you're still earning between $40,000 and $50,000. Okay, so depending on how long your residency training is, they might increase about maybe a few $1,000s a year, and you still have to learn to live little. That is why we have delayed gratification in medicine, because the passion of wanting to take care of patients supersedes the monetary benefits of the profession. Okay, now after residency is over, now you become an attending. Well, if you finish residency and you decide not to go into fellowship, if you decide to go into fellowship, you become a fellow and you're still underpaid and working longer hours. Okay, but once you become an attending, then you get to have a better life depending on what specialty you're on. Okay, some specialty are more demanding that you need to be in the hospital longer and you still work longer hours even despite being an attendant. Some specialty are not. So it's up to you whatever specialty you choose. But the most important thing about picking a specialty is never ever pick a specialty based on how much money you're going to make, because I can guarantee you the price you have to pay for medical training, the years and the long dedication, is not worth picking a specialty based on the compensation you're going to get at the end, because you will be so miserable. Getting out of bed in the morning is going to be such a hard thing because you picked the wrong specialty. But if you pick a specialty you really enjoy, like for me, I love emergency medicine. Like I get up in the middle of the night and yes, we're going to the emergency department and we got to take care of patients and we don't know what's walking through that door. But when they come in, we got minutes to save your life. And I enjoy that. It's adrenaline rush, it gets you going. You got to think clinically fast, intervene immediately, immediately and save patients' life. So that's how I get my enjoyment from my profession. Now, other people have different love for what they do, and everybody eventually picks something they like. Okay, now this is what residency truly is, and I just wanted to give you guys and shed some light on it. Okay, I hope you enjoyed this video. And if you really enjoyed it, please don't forget to click on the subscribe button to this channel and visit my website, www.ftplectures.com, to watch over 300 hours of clinical videos, educational videos that will help you enhance your knowledge in medicine. Thank you. Have a wonderful day. Bye-bye. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX, or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.